Welcome back. Well, May is Stroke Awareness Month, and it's important to know the warning signs and symptoms ahead of time in case you or someone you know suffers from one.
And Dr. Sani Kabaz, a neurologist at Aurora Baycare Medical Center, joins us now with more. Thank you so much for being here.
Thanks for having me.
Now, let us know, what is a stroke?
A stroke is when a part of the brain does not receive enough blood and oxygen due to a blockage or a clot in the blood vessel that is feeding that area of the brain. It's an area that is functioning as it really helps certain parts of the body to work, and when it does not get the blood and the oxygen, it stops functioning, and that affects that part of the body that it really controls.
And unfortunately, it's pretty common too, right? I mean, thousands of people suffer from this every single year.
It does. Actually, the numbers are almost 800,000 people are affected with stroke every year.
And talk about the demographics too. Who's affected, who's not, that sort of thing.
It has a huge demographic statistics that African Americans are actually more affected than whites. Age also is a factor in affecting strokes, in that the older the person, the more chances that they get a stroke. Males are more affected than females in stroke.
Now, so what are some of the warning signs and symptoms of stroke?
You know, the important thing is to remember that stroke, if somebody follows what we call an acronym of B FAST. B is balance. E is eyes. Any problem with eyes, such as loss of vision or double vision. F is for face, if there is a droopy face or a twisted face. A is arm, weakness in the arm, numbness in the arm, or also the leg can be involved. S is speech, if there is slurred speech or inability to speak or inability to communicate. And T is important because it is time. The earlier the patient gets to a hospital, the better chances are to be treated, and disability is much less.
So again, there's the acronym right there, FAST. And of course, you want to act fast too. If you know someone suffering from a stroke, I mean, you just said it right there. It's important to make sure to either call 911 or get them to a hospital. And what does it mean to have a comprehensive stroke center? Why don't you tell us about that?
A comprehensive stroke center is a center where there is the patient is treated from the time they get to the emergency room to the time that they are discharged, and it's a center where they give the patients the best advanced and high quality care. They are really subjected to a very strict criteria and stringent criteria that they have to meet to be able to be qualified. They are centers that have a full-time in-person neurologists, neurosurgeons, interventional neurologists that can treat the patients from the time they get to the emergency room in an appropriate and timely manner, and then move them to care units that are very important in their care. And Aurora Baycare Medical Center is one of the first and certified comprehensive stroke centers in the Northeast Wisconsin.
Now, what can we do to prevent stroke?
The most important thing is to make sure there are two types of risk factors, preventable and non-preventable. The non-preventable, you cannot control them, which is age, race, and ethnic background. But the preventable causes for strokes are high blood pressure, diabetes, cholesterol, smoking, and physical activity that's important. So these have to be treated aggressively so that we decrease the risk of having a stroke.
So again, take care of your body, and your chances of getting a stroke will go way down. So again, Dr. Kabaz is with Aurora Baycare Medical Center talking about Stroke Awareness Month. And coming up in our Health Watch, we're talking more about this and other measures to make sure that you can stay safe. Doctor, thank you so much for joining us this morning.
Thanks for having me.
We'll get a check on your forecast coming up on Local 5 this morning, right after this.